So how is diabetes typically treated, and why it's wrong? A lot of our patients would come into the clinic and we would ask them why they thought they were diabetic. And most of these patients at the time, they were in their late 60s to mid 70s. And I'd ask them why they thought that they were diabetic. And they said, well, our insulin's no longer good, or our pancreas has stopped working. Now, pancreatic burnout, or late onset type 1 diabetes, is a very real thing, but we don't see it very often, but it is a real thing. There are certain characteristics about a person with pancreatic burnout or late onset type 1 diabetes that definitely stand out to us. So you would know if you fell into that category already, because your doctor would have pointed that out to you as well. So there's certain characteristics of people with this late onset type 1 diabetes that are very different from type 2 diabetics. So you would know if your pancreas has just stopped working, but that's not the case. Your pancreas, we know, is perfectly capable of regenerating the cells, their beta cells that produce insulin. We know that from bariatric surgery, patient follow-ups over 10 and 20-year periods of time, where these patients had such fatty pancreases that their pancreases were no longer capable of producing insulin. But once they lost their weight, their pancreases regenerated these beta cells and were capable of producing adequate insulin. So we know that can happen. And that's what people have been diabetic for 10, 20, 30 years before they've had surgery. So we know that can happen, and we know that the insulin is still quality. Insulin doesn't go stale as you get older. It still works. It still works fairly well. But let's talk a little bit about how diabetes is currently treated. If you had an infection, say you knew your spouse had pneumonia. So say your spouse has pneumonia, and they tell you that they're going to take Tylenol to treat their pneumonia. You know that's crazy, right? And so you know that wouldn't help. That might help them control their blood pressure or their body temperature, but that wouldn't help them control their pneumonia. So a symptom of pneumonia would be a fever, but the fever is not the cause of the pneumonia. So taking Tylenol will help control your body temperature for a little bit, but it's not going to fix the pneumonia. And as the pneumonia gets worse and worse and worse, then it's going to take more effort to control your body temperature. And eventually, you're not going to be able to control your body temperature at all, because your body temperature is just going to be so completely unable to be controlled because of the pneumonia so completely out of whack. The bacteria is growing and growing and growing and growing. So you might want to have this ideal body temperature, but eventually the Tylenol is just not going to cut it unless you treat the bacterial infection. Now in diabetes, we know diabetes is caused by too much insulin. Once you store your body and fill your body up with all these jerry cans of insulin, the insulin has damaged the cells. The insulin's first job is to try to take that sugar and put it in the cell. And so it tries, and it bangs on the cell, and it bangs on the cell. It says, let me in, let me in, let me in. But the cell won't let it in. So then insulin says, okay, and it sits there and it will store the sugar as fat. But when we're eating so much sugar and we're trying to get all that sugar into the cells, we have all these insulin molecules banging on our cells saying, let me in. And the cells eventually, their doors get broken over time and they get stuck shut. So that is how diabetes develops. So we'll talk about that in the next couple of slides before we take a break. So we're almost at break time, guys. Another like 15 minutes, and we'll be on to our first break. So what happens is we have had so much insulin, it's broken down our cells. So the cells can't take up the sugar anymore, and that sugar just ends up sitting in the blood. So we get this high blood sugar level. So what do? We don't fix the situation. We don't eliminate the insulin. We don't lessen the number of insulin molecules pounding trying to get into the cells. We don't let the cells take a break to heal. We give you medication to help drive those sugars into the cells, and we give you medication that takes the sugar out of the cell and put it elsewhere in the body. So a lot of these medications, all they do is they take the sugar out of the blood and they put it elsewhere in the body, since they can't put it in the cells to be used as energy. So some of them take the sugar out of the blood and they put it in the liver. Sometimes they take it out of the blood and they put it somewhere else in the body. So all of these medications, all that they do is they take the sugar out of the blood and they store it elsewhere in the body. So it's like if you have a really messy kitchen, you can take all of the garbage out of your kitchen and you can put it in your basement and your kitchen will be cleaner, but your house isn't cleaner overall. It still has the same amount of garbage in it. And if your kitchen then fills up and becomes messy again, you can take the mess and you can put it in the basement. And then the basement becomes more and more and more and more messy over time, and it fills up with garbage. But you can still have a clean kitchen. And eventually your house is still going to get so full that there's garbage everywhere. You can't take the garbage out of the kitchen anymore because your house is just condemned. And this is what happens with diabetes. Your blood sugar levels go up, so we give you medication to take the sugar out of the blood, and we store it elsewhere in the body. But then you get kidney disease, and then you get diabetic eye disease, you get diabetic nerve disease, you get fatty liver disease, you get fatty pancreas, you get Alzheimer's disease, because you get all the sugar stored in your brain. And that's all these medications are doing. They're helping your body store sugar elsewhere. So you get this really contaminated body, and then your blood looks okay, but the rest of your body becomes contaminated with sugar. So your blood's not contaminated, but your body is. And then over time, your body just fills up, and there's nowhere else for the medication to take the sugar. So then you just get these high blood sugar levels. So we give you all these medications, and that's all that they do. There are a few medications out on the market now. They're relatively new. A couple of them have been in Canada for a few years now. They're Invokana, Jardiance, Forxiga in Canada, or Farxiga in the United States. So I'll type those in the chat box. You probably have seen commercials with them. Like all medications, they too do have side effects, and potentially serious ones, like ketoacidosis. Metformin has lactic acidosis. Januvia has pancreatitis. All these medications have different side effects to them, some mild and some very serious side effects. But those three medications, they're unique in the sense they actually cause your body to urinate out the sugar. So because of that reason, people who do take those medications are a little bit more prone to urinary tract infections. Those medications, they actually cause your body to urinate out the sugar. So they're ones that's like taking the garbage down to the street, and you're getting it out of the house, and the garbage man's going to come and collect it. So for a certain population of patients that can do well on them, there is a population of patients with various medical conditions that can't take them. But they are the only three ones right now on the market that actually remove sugar from the body.